Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.
Heading into the new year, there was reason to cheer. Vaccines were available for children 5 and up. Booster shots opened up to anyone 16 and older. And the words we long to hear, it's okay to gather with loved ones. Then, the emergence of a new variant, Omicron. And with Delta cases on the rise, there's a renewed fear. We're here to answer your questions about the virus, variants, the vaccines, and share some hope about new COVID treatments on the horizon and the path forward. Let's get armed against COVID, starting now.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to our COVID Vaccines Armed Against COVID Town Hall. I'm Olga Villaverde. Our esteemed panel of doctors is here to share some information and help us understand what it's going to take to get COVID in the rear view mirror. Our moderator is Dr. Michael Zinner, CEO and Executive Medical Director of Miami Cancer Institute. He was the clinical director at Dana-Farber and chief of surgery at Brigham and Women's Hospital, as well as professor of surgery at Harvard Medical School for 22 years. Welcome, Dr. Zinner.
Thanks, Olga. This pandemic has been with us for nearly 2 years. And we know that almost everyone who is watching this program wants to know the following. What is it going to take to end the overwhelming death and devastation brought on by COVID-19? Now, we may never truly end this disease. Unfortunately, that's just how viruses work. But we all want to get back to something close to normal. So tonight, we will be talking about a realistic and hopeful future. Yes, there are new and still dangerous variants circulating here and around the world. We can't minimize that or pretend they aren't truly deadly. And yes, cases have been rising recently, just as they did last year during the winter months. But we're not the same as we were last year. We have vaccines now. We have boosters, and we have medications that appear in ways to work differently than the vaccines. We'll discuss all of this, as well as the newest and latest information we have on the variants, vaccines for children, and immunity. And to answer your questions, we have reached out to our internationally recognized experts to help us. Olga, let me turn it back to you.
Thank you, Dr. Zinner. We welcome back Dr. Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at Grady Health System. Dr. Del Rio is known for his work on emerging infections, epidemics, and pandemics. Dr. Tina Carroll-Scott is the medical director of the South Miami Children's Clinic. Dr. Scott has built her career as a pediatrician focused on populations in need. Dr. Scott has been instrumental in educating the community about COVID-19 and the vaccines to improve access and equity. Dr. Peter Hotez is the Dean of the National School of Tropical Medicine and the co-director of the Texas Children's Center for Vaccine Development. He is a scientist, researcher, and science explainer. We welcome all of you, and we thank you so much for joining us tonight. Dr. Zinner?
Thank you, Olga. We also have Dr. Ashish Jha. He's Dean of the School of Public Health at Brown University. He's also on the front lines of COVID response, providing analysis in the development and policy. I spoke with Dr. Jha earlier and asked him about the Omicron variant, how serious is it, and what concerns he has with this new variant. Let's hear what he has to say.
I think we're already learning a lot about Omicron. As you know, science works, but we're starting to get more and more data. So I think that we know a lot more than we did just a couple of weeks ago. And based on everything we know right now, yeah, I am concerned. I think this is in some ways, it may be the most serious variant we have seen so far. Certainly looks like the most contagious. And we're going to have to do a lot of work to manage this and control this as it goes to our population in the weeks and months to come.
Great to hear. So I'd like to go around the panel and get each one of your reactions to this. Dr. Del Rio, let me start with you.
Well, thank you, Michael, and thank you for having me with you again. I think, Omicron is really throwing a significant curveball on the approach we're having to this pandemic. And the reality is the information is emerging. I think we have some data right now which is encouraging, and I think we have some data that is very concerning. It is much more transmissible than Delta. It is less susceptible to antibodies, in both monoclonal antibodies and vaccine-related antibodies. And we don't know yet how severe it is, but preliminary data suggests that maybe the disease that causes is not as severe as that caused by some of the other variants. It also shows that if you have been vaccinated, you have been boosted, you seem to be better protected against this variant. So this is why CDC and others are suggesting that everybody should be vaccinated, and everybody who's been vaccinated needs to be boosted. The other thing we learned is that natural infection, having been infected previously with COVID, offers no protection against this variant. So people who have previously had COVID need to get vaccinated.
Dr. Hotez, I'd be curious to hear your thoughts. I mean, you still say Delta is the big threat. Can you follow on, please?
Yeah, I think there has been somewhat of a change. Certainly Delta is the big threat right now, but I think from what we've seen in the United Kingdom, I'm quite concerned. I was hoping that we would not see what happened in South Africa reproduced in the UK, but unfortunately it's really accelerating, and we've heard some very worrisome and troublesome remarks from Boris Johnson, the British Prime Minister, today. It's rising rapidly. It looks like it's going to become the dominant variant in the UK quite soon. The reason that's concerning to people in the United States here is because what happened in the UK with the Alpha variant in September was ultimately reproduced about 4 to 6 weeks later in the US. Same with the Delta variant. So I think we have to assume that Omicron is going to dominate here as well. I think we'll have a twin epidemic of Delta and Omicron. My big worry right now is the surge on the health system and the hospitals, particularly because of waning immunity after boosters, and whether our healthcare professionals will also get sick from the Omicron variant. So that's going to add some additional complexities. Bottom line, I think it is going to be a pretty rough January, February.
Dr. Scott, I'd be curious on your thoughts also.
Yeah, so I'm going to piggyback on a lot of what was previously said. And with Omicron easily becoming the dominant variant in the coming weeks, and with the holidays approaching and people gathering together, it's really the perfect storm. And we don't know the severity of Omicron disease and whether the high rate of pediatric hospitalizations in South Africa is a true signal that can be translated to the US. So we do need to remain vigilant, and that means getting vaccinated if you haven't already done so, boosted if you're eligible, and continuing with all of the mitigation strategies that we've been using, such as masking, social distancing, and hand washing. The vaccines are a key component to ending this pandemic, but it's not the only thing, and it really has to be a comprehensive approach.
Talking about vaccines, let's talk about the vaccines and who's eligible for them. Olga, let me have you bring that in.
That's a great idea, Dr. Zinner. We actually have the recent vaccine and booster recommendations from the CDC. Take a look here as we go through it. When it comes to vaccines, Pfizer vaccines are recommended for ages 5 and up. Moderna vaccines recommended for ages 18 and up. Johnson & Johnson also 18 and up. Pfizer is recommended for teens 16 to 17 years old. Any authorized COVID vaccine, adults 18 and older. And with both Pfizer and Moderna, you should wait at least 6 months. Johnson & Johnson, the wait is 2 months. So those are the recent recommendations, Dr. Zinner.
Thanks, Olga. Dr. Hotez, I want to get your thoughts on the vaccine recommendations for children. Are we going far enough? Are we in the right place right now?
I think my big concern is the fact that we are under vaccinating our kids. A very small percentage of children 5 and up have been vaccinated, especially between the ages of 5 and 12. And here in the southern part of the United States, we're also doing pretty badly vaccinating our adolescents 12 to 17. So that's a real vulnerability here against the Omicron variant. And as Dr. Scott rightly points out, we have seen a lot of pediatric hospitalizations in South Africa from the Omicron variant, including some pretty young kids. So I think one of the important messages for this evening is get your kids vaccinated. So as Dr. Del Rio appropriately points out, get boosted if you're eligible. If you've been infected and recovered, you'll do a lot better if you get vaccinated on top of that to be more resilient against your variants. But the third piece is vaccinate your kids. We're profoundly underachieving in that aspect, and now's the time to do it ahead of that Omicron variant. And again, we're seeing a lot of hospitalizations in kids in South Africa, and I'm quite concerned about, once again, our pediatric intensive care units, our children's hospitals getting overwhelmed like they did partly with Delta over the summer in the southern United States. We could be in for something potentially even worse with the Omicron variant.
Dr. Scott, is there a wide gap in vaccinations in children in the underserved community? And I'm going to assume that answer, and what can we do to bridge that gap to improve access?
Okay, so I would start off by saying that access and equity were major issues as the vaccines were initially being rolled out across our state. And that was actually the impetus behind the 4 pop-up vaccine events that I held in the community where I work. But I think at this point in the pandemic, it's much less of an issue as the vaccines for children are available at many school sites now, multiple retail pharmacies, county vaccine sites, children's hospitals, and even pediatric offices. So I think the bigger issue now is the misinformation that's being circulated on social media. Social media, it really has been a blessing and a curse during this pandemic. And it's taken on a life of its own when it comes to the myths and fear mongering regarding the vaccines. And I would say even more so in communities of color. And within these communities, there's also a major trust issue, especially in the Black community that has experienced medical experimentation and exploitation in the past, and implicit racial bias that many have encountered in our healthcare system, even currently. So I think we've reached a point in the pandemic where probably broad public health messaging is not going to move the needle much. I think some people have dug their heels in, so to speak, when it comes to not wanting to get vaccinated. And the reasons are really different for everyone. So I think we need to use a more organic grassroots effort to reach those people, essentially meeting them where they are to answer specific questions about their vaccine hesitancy, and using trusted messengers in the community as well, such as myself, pastors, and other community leaders, who I think are critical, when it comes to disseminating credible information.
Yeah, and Tina, that's exactly where I would hope you would go with that. That issue of vaccine hesitancies in certain of the underserved population, and particularly in the communities of color, is that the way we need to solve the problem? Getting out to messengers, trusted messengers, and getting out there in sort of retail community activity?
I think that's part of it, and because I do think in these communities representation absolutely matters. But I also believe that we're at a point in the pandemic where we need to recruit everyday citizens in the community who have been fully vaccinated to be ambassadors, and to basically spread the word to their family members, coworkers, neighbors, friends, to get them over that threshold to vaccine acceptance, and basically talk about their experience and what their fears might have been, and the fact that they took a leap of faith and they got vaccinated and they're still standing. Nothing bad happened, and I think that's probably the tack that we need to take moving forward. And it is going to be everyday, ordinary people giving their own personal experience with getting vaccinated to get people on board.
Olga, let me toss this back to you. Questions from the audience?
Thank you, Dr. Zinner. I just got a question in, and I want to read it out loud, and maybe we can have one of our experts chime in. Someone is asking, children under 16 can't get boosted, so what do we do about that? Dr. Zinner?
Let me turn that to Dr. Hotez. Can you answer that, Peter?
Yeah, I think they're still waiting for safety data and efficacy data as well. I do think they eventually will become eligible for boosters, and it's a matter of trying to collect the data in real time and trying to move as expeditiously as possible without compromising safety. So I do think it's likely we will see boosters. Remember, those groups that were vaccinated later, so the drop-off is not as imminent because it's not been as not as much time has passed. I think the other piece of this is the immune response in the younger individuals has been more robust, so there may not be that same urgency, but I do think boosters will likely be forthcoming.
Okay, thank you. Olga?
Dr. Zinner, a couple of questions coming in from the audience. Many people are asking if it is safe to mix COVID vaccines, and they want to know if I received 2 Moderna vaccines, is it okay to get a Pfizer booster? Dr. Zinner?
I've heard the same questions from some of the folks in my community and at Miami Cancer Institute. Let me turn this to Dr. Del Rio. Dr. Del Rio?
Well, Michael, I think the data is very clear. Your immune system doesn't care what you receive. I've never heard this before, honestly. I never heard people say, well, I got the Sanofi Pasteur vaccine for influenza, should I get a different one? The reality is it's a vaccine, and your immune system recognizes. What we've learned from clinical trials, including the mix and match study, is that it's probably important to get an mRNA vaccine at some point in time. So if you got Johnson & Johnson, get an mRNA booster. But if you got any of the mRNA vaccines, whether it's Pfizer or Moderna, get whatever you can get, either Pfizer or Moderna. At the end of the day, that's what you need. And I tell people, get whatever vaccine is available to you. Right now, in most of our communities, Pfizer is what's most readily available. That's what you need to get. So don't shop for a vaccine. Get a booster.
Thank you, Carlos. Let me turn this back over to Olga.
Here is another question, Dr. Zinner, we're getting from many viewers, I must say. They're asking this. I got vaccinated, some with Pfizer, others with Moderna, of course. Am I protected against Omicron and other variants that will certainly develop in the future? Great question there, Dr. Zinner.
Yes, I mentioned I've been hearing that same question from not only my colleagues, but my employees at Miami Cancer Institute, and they want to know if they need a booster. Earlier, as I mentioned, we talked to Dr. Jha on the same question, and here's his response.
So here's what we're learning so far. And again, preliminary data, we've got 6 or 7 studies out of labs now, looking at how well the antibodies that vaccines produce or a prior infection produces, how well those antibodies neutralize the virus. And here's what we're learning. If you've had 2 shots of a Moderna or a Pfizer or 1 shot of J&J, or you've had previous infection but have not been vaccinated, you don't have very much neutralization of the virus. That means I think you're going to be at very high risk of getting a breakthrough infection. If you've had 3 doses, if you had a booster, we see much, much higher levels of protection. So my feeling at this point is the data's coming in pretty clear. Everybody needs a booster, especially if you're 6 months out from your second shot.
Dr. Hotez, we've heard this now. What about patients that are immunocompromised, like patients on chemotherapy or certain medications for rheumatoid arthritis or even transplant patients?
Well, before, just to add a little bit to what Ashish said, Dr. Jha said, when you get that 3rd immunization, what you do is you get a 30 to 40-fold rise in your virus neutralizing antibodies often, in addition to T-cell protection and other aspects of the immune response. And that's why you might be in a better position to weather these variants of concern like Omicron. In fact, the UK government on Friday released some information, preliminary data, saying it gives you about 70 to 75% protection against symptomatic illness. Not as high as we'd like compared to the other variants, but not terrible. The thing that does trouble me, though, is we are seeing in some preliminary data out of Germany saying there is a pretty steep drop-off after that. So the question's going to be, the 3rd immunization, no question, you're going to need this to protect yourself against the Omicron variant. How long will it be? And would there ever be a need for an additional immunization after that, an unknown? And now if you're immunocompromised, the CDC has green-lighted giving 4 immunizations as well. And so and it really depends on how immunocompromised you are. And for this, it can be very complicated for the generalist. Most people who are immunocompromised are under the care of a specialty physician, such as an oncologist, a rheumatologist, or allergist immunologist. Have that conversation to get a sense, because being immunocompromised for being a solid organ transplant recipient and the medications that go with that is not the same as saying being on Humira. So you want to have that conversation with your specialty physician.
Olga?
Dr. Zinner, thank you. There are concerns about this winter, about both Delta and Omicron, and Dr. Hotez had mentioned it earlier, and maybe even another variant out there. So people are asking, how can we best protect ourselves during the winter months ahead? Dr. Zinner?
You know, that's a great question, and Dr. Jha has some insights on this. Let's hear from what he has to say.
And of course, we also have the flu, which is around every year, right? And that's also becoming a problem in some parts of the country. What I expect is by the time we're sort of into the holidays, it's still going to be largely Delta. Omicron is going to come on probably more strongly by the end of December into January. It really is going to push our hospitals. And one of the reasons, of course, is that, you know, we've had such a difficult 2 years. So many doctors, so many nurses burnt out. Staffing challenges are really pervasive across the country. So take staffing challenges, throw in flu, throw in Delta, throw in Omicron. Really worried about what the next couple of months are going to look like.
Carlos, let me turn to you. Even though we have vaccines, we seem to be tracking the same course as last year with respect to infections. Maybe not quite at hospitalizations or deaths yet, but where do you see us in this season?
Well, you know, as Dr. Shah says, I am concerned, but at the same time, this is not a poltergeist, right? This is a virus. We know how it's transmitted. We know what to do to avoid it. I think, to me, what concerns me the most is that we still have, you know, over 50 million Americans who aren't vaccinated. And again, I would encourage people today, you cannot wait anymore. If you have been waiting to get vaccinated now. I hear many people say to me, well, you know, I wanted to get some more experience. Look, close to 500 million doses of vaccine have been given in the U.S. More than 8.5 billion doses have been given globally. This is not a time to wait for more experience. If you haven't been vaccinated, get vaccinated, do it before the holidays. The second thing is we know how masks work. We know about, you know, doing things outside is better than inside. We know how, you know, use testing. Again, the Biden administration is trying to make testing available for everybody essentially for free. We know how to stop this virus. We know how to prevent transmission. So at the end of the day, this is not about being scared. This is about doing the right things. This is no different than driving down, you know, an icy road. We know how to do it. We know how to survive it. So at the end of the day, if people do the right thing, we can prevent this virus from taking hold. The problem that I'm seeing is that people are thinking that this is over. And unfortunately, this is not over. So thinking this is over is probably the most dangerous things you can do.
Tina, I want to turn this back to you. We've sort of heard several allusions about how we're going into this winter and we've still got COVID, but we've also got flu in a different way than we've had before, or at least last year. What can you tell us about putting together flu and COVID and whether or not you can get the shots at the same time?
Yeah, so I'm being asked the same question by many parents, and yes, you can get both at the same time, and that's what we've been doing in my office. And you know, I want to reiterate a little bit what's already been said. You know, that getting together for the holidays, there really is no 100% risk-free plan. And I think all of us will have to do our own individual risk assessment when it comes to traveling and getting together for the holidays. And the most ideal option that I think will pose the least risk is to have everyone fully vaccinated, not only for COVID, but flu as well. And, you know, and also getting the booster for those people who are eligible. And I think that, you know, that we've reached a point now where I think some families are going to have to make some really difficult decisions because, of course, it's ideal to have everyone vaccinated, but we all know we have certain family members who have decided that they don't want to get vaccinated and have kind of dug their heels in when it comes to that. And I think, you know, that in those scenarios, you know, I mean, we may have to make difficult decisions about not socializing with those family members around the holidays, whether it's not having those people come to your house or vice versa. And I know those are really difficult conversations to have, but I think, you know, especially if you have family members that are immunocompromised in some way, even if they're fully vaccinated and boosted, you know, we know that those people are still vulnerable.
Thank you, Tina. Earlier today, I asked Dr. Marcos Mestre, who's the Chief Medical Officer at Nicklaus Children's Hospital in South Florida, what can parents do to best protect their children? Let's listen and see what Marcos has to say.
The main thing we're trying to get across to families is with any variant that comes up, we want to protect the children as soon as possible. Just because here in Florida and specifically in Miami, the rates are lower, doesn't mean that that Omicron variant or any other variant down the road could come across and start infecting more people again. So it takes about 5 weeks to be completely protected once you're vaccinated. So sometimes you don't have enough time in order to get vaccinated to be fully protective. So I always say right now, even though our rates are low, to go ahead and get protected. We don't know the severity as it relates to Omicron. It does appear to be more infectious than other variants, but in terms of severity, the jury's still out. We're trying to figure out how that affects kids especially.
What special concerns do you have for children with underlying conditions like diabetes and asthmas, and what do you tell those parents?
Yeah, those children are always going to be at a little bit of higher risk, especially those children that are overweight or obese, and if they're teenagers. Those are the children that we've seen the most complications in related to any of the variants across the entire pandemic. But if you do have diabetes or an underlying medical condition such as asthma, hypertension, sometimes we see in children, those children are going to be a little bit higher risk of any sort of complications. Thankfully, most children are going to do well with any sort of infection, but they are that population of children that may have complications.
Dr. Hotez, I know you're a pediatrician also, and I'm curious what you're seeing and what you're advising parents as we enter this season also.
Well, I think the most important, of course, is if your child's eligible to be vaccinated. We're seeing this, what we're seeing with Omicron in South Africa is very worrisome, and we've seen a lot of kids with Delta get it. So I think in the early stages of this pandemic, we talked about the narrative of overwhelmingly of older Americans, but now with Delta and now with Omicron, this is more and more of as much of a pediatric illness as anything else. And so kids are at risk. You need to get them vaccinated. The other piece that we don't talk about enough are the long COVID signs and symptoms. And we're still in a steep learning curve when it comes to pediatric populations. In London, the Great Ormond Street Hospital, the big children's hospital in London, has come up with a number of about 1 in 7 kids can have long COVID signs and symptoms lasting more than a year. But we don't really know what that means in terms of long-term neurodevelopmental complications. Is it going to be the same as adults or not? So the key is, I think it's prudent to err on the side of safety. Get your kids vaccinated as soon as they're eligible. I know it sounds a bit like a broken record, but I emphasize it because we've done so badly in terms of our rates of vaccinating kids 5 and up. Parents are waiting. I understand that the hesitancy, but now with Omicron bearing on upon us, I think now's the time to do it.
Peter, thank you. Peter, thank you very much. We appreciate your contributions this evening and your contributions in general. We know you had to leave early and that you've got some issues dealing with outside. We appreciate it. So thank you for having joined us tonight. So good night, Peter.
Thanks for the opportunity, and my best to my great colleagues here tonight.
Thank you. Now I'd like to turn to Tina and say, we've been hearing issues now about children wearing masks in schools and some schools allowing the students to come without masks. Is this too soon to dispense masks in school?
Yes, I think it's absolutely too soon, especially because we literally just started rolling out the vaccine for the 5 to 11-year-olds a few weeks ago. And we still have a large percentage of children 12 and over who are not fully vaccinated. We just started rolling out the vaccines for the 5 to 11-year-old age group. And then we still have a whole subset of kids who are not even eligible to be vaccinated and probably won't be eligible until after the new year, early 2022. And as stated before, we know that masks drastically reduce transmission, and probably close to 60%. And so I think we need to set our kids up for success and not failure. And they've suffered greatly over the last 2 years with not being able to go to school in person and a host of other issues that we've seen as a result of this pandemic. And so I think that, I understand that we all want an off-ramp, and we do need one sooner sooner than later, but I think that we're not at that point yet. And I don't know what that number is going to be as far as what percentage of children we need fully vaccinated to say that it's time for the mask to come off. But I'm thinking it probably needs to be over 70%. And we're not there yet.
Tina, thank you very much. Let me turn this back to Olga.
Thank you, Dr. Zinner. You know, we have a few questions about traveling during the holidays and getting together with friends and family. So many viewers are asking, is it safe? Your thoughts, Dr. Zinner, as well as our panel?
That's a great question. And before we hear from our live panel, let's turn it over to Dr. Jha, who also had some thoughts on earlier today, and then we'll go to the panel.
Based on everything we know right now, this holiday season, if you're vaccinated, especially if you're boosted, if you're traveling to see family that's vaccinated, I think it's quite safe to do. We know that traveling itself, the airplane, airports can be quite safe, especially if you're wearing a high quality mask. And so I'm very comfortable traveling this season. I have my mother-in-law coming and visiting us from Florida. I think it's a safe thing for her to do. She's boosted. Our family's all vaccinated. If you're unvaccinated, of course, the risk is much, much higher with that mixing. And we do tend to see during holidays infection numbers spike, largely because of when unvaccinated people get together.
You know, I was glad to hear that from Ashish. My family is coming in from Boston. My children and grandchildren are coming down. So we feel comfortable in traveling at this season, but with some of the same concerns and limitations. Carlos, let me turn to you. What are your holiday going to be like, and what are your travel plans, and what can you share with us about that?
Again, I agree with what Dr. Jha said. I think if you're vaccinated, everybody's vaccinated, it's fine. You know, I think testing is also a useful strategy. If you're going to be traveling and you're concerned, you know, get rapid tests, test yourself before you travel, test yourself after you travel, test yourself before you go into an event. I think we have not used testing appropriately in this country. Part of it has been because it's expensive. It's $25 a pop, right? In Germany, you can get a rapid test for $1. In the UK, you get them for free. I don't know what our government is waiting to give tests available to people. If we had tests available, we could be so much easier. I mean, it's so easy. I travel all the time to visit my kids in Florida and in New York. I test myself. I've never been infected. I think testing is a very useful strategy when you're trying to get together with family.
Tina, I'm curious, not only your answer to the question about families getting together and traveling, but what's been the effect that you've seen on families not being able to get together, and the children in the families, and in my case, the grandchildren in the families? What have you seen out in the community?
I think that the mental health toll has been tremendous throughout this pandemic for all of the reasons that we've stated, and you know, and I think that's really the sad part of this whole pandemic. As a pediatrician in practice for over 25 years, I don't think I've seen, you know, this level of anxiety and depression and suicidal ideation, you know, that I'm seeing in the last year and a half, 2 years, and so you know that unfortunately is you know one of the sad parts about what's happened with this pandemic. And regarding the the home testing, I do agree that it is critical for us to have access to that. But the sad part is, in a community like where I work, with kits running anywhere from $15 to $25 a piece, a lot of low income patients will not have that available to them.
You know, Tina, you bring up a very interesting point in your last comment. Although we were talking about traveling and the holidays, you bring up the issue of children and their psychological effect from COVID. I mean, we did see some things in COVID in the teenage groups and in that category of patients that we had not seen before. Yeah, is it too late to do remediation, and are there things we can learn about what happened during that period that can apply for us going forward?
I'm hoping it's not too late, although I think that a lot of the damage that's been done over the last 2 years is going to take a long time to repair. And if I'm going to be honest, it's even affected my own mental health, because being in PPE and not being able to practice the way that I enjoy as a pediatrician, and having those types of connections, that's affected me as well. So I am tremendously tremendously concerned about that. And that's why I'm really pushing parents to get their children, their families back to some type of normalcy as quickly as possible. And the vaccines are a key component to doing that. We must get as many people vaccinated as possible so that we can create that wall of immunity or protection and at least, tamp this virus down to the point where it becomes endemic. And so, we're basically dealing with the flu or the common cold. And we're so far from that point right now. I mean, yes, we've done well as far as getting people vaccinated, but there are still so many people that are unvaccinated in this country who are eligible to be vaccinated. And, regarding the boosters, I mean, yes, we need those as well, but we can't boost our way out of this pandemic either. Really, the key to getting this under control is getting the millions of people who are currently unvaccinated vaccinated.
Carlos, this issue of dealing with the mental health complications or effect of COVID is talked about in the adult population around burnout, but have you seen this extend to other areas? And I'd be interested in your thoughts also.
Yes, absolutely. I think, everybody I talk to, we're all tired of this. We've had it. We can't take it anymore, right? I mean, this has been really, really tough. And I think what we need to do, those of us in public health, we need to figure out how to tell people how to do things and how to do them safely. And, at some point in time, there's going to be a certain degree of risk people are going to have to take. Nothing is 100% safe. But as I tell people, driving down the freeway is not 100% safe. There's certain activities we do, but we try to minimize risk. So risk reduction, risk mitigation is important. But at the end of the day, we cannot continue to tell people, don't go anywhere, don't go out, stay in your home, do this, do that, because the reality is that people are tired. People need to get together, and we need to figure out how to do it safely. And at the end of the day, I think as we transition into a more of endemic phase, I think we're going to have to, in public health, to accept how much transmission, how much disease are we willing to take. And in my mind, the most important indicator, Michael, is not to overwhelm hospitals. And the key to not to overwhelm hospitals is really vaccination. We may not be able to stop infections, but can we stop overwhelming hospitals? Can we stop mortality? And if we can do that, I'll take it.
We have another question from the audience. This one is actually from Monica, and this is what she writes. Let's read this. I have a child with allergies. He has a serious peanut allergy. Is the shot safe? Great question, and I know many people whose children have peanut allergies. Dr. Zinner?
Tina, can you help us with this one? Peanut allergies, do they have any bearing at all on the vaccine?
None whatsoever. So food allergies, environmental allergies, none of those things are a contraindication to getting vaccinated. And really only if you have an allergy to a specific ingredient in the vaccine. So for example, with the mRNA vaccine with the polyethylene glycol. And if you have an allergy to that, a known allergy, then that would be a contraindication. Or if you've had an allergic reaction to an ingredient in a vaccine before. But other than that, there's no contraindication with food allergies, environmental allergies, or anything like that.
Great to know. Thank you. Let me turn this back to Olga.
Thank you, and great answer there. Here's another question that we got from Jill, and she wants to know about her reaction to Moderna booster. This is what she writes. Had my booster shot Moderna. Why did I have a reaction of achiness and 99.9 temperature? Is this expected for immunity? Dr. Zinner, thoughts on this?
Carlos, your thoughts?
I would say congratulations. That means your immune system is doing the right thing. That's not called a side effect. That's called reactogenicity. That means your immune system is responding to the antigen, is producing antibodies, is producing a reaction. So yes, that is actually very good. As you get older, those reactogenicities go away. It's called immune senescence, means your immune system is getting old. And so in a way, being thankful, you're probably not that old.
Carlos?
Can I add something?
Yes, please, Tina.
Yeah, I want to add something because that's probably the biggest concern that I hear from patients is that they don't want to get sick. And I think we actually did not do a great job of educating people about what the normal side effects of these vaccines are. And so I have patients who, even if they got the first vaccine, they've heard that the second dose is much worse and that you're much more symptomatic with fever fever and chills and all of that, and they've opted out. And so, it's really unfortunate. And, and I'm trying to do a lot of that education with my own patients and within the community to let people know, no, all of that is completely normal. And, it means that your immune system is doing exactly what it's supposed to do. So in the event that you're exposed to the real thing, the SARS-CoV-2 virus, that you will be protected.
Well, I'll just add, not only do you get a reaction to the COVID vaccine, but there are a lot of other vaccines out there that when you take them, you also get a reaction to. I can say that personally. And in fact, I thought the COVID reaction was minor compared to some of the other reactions I had to the vaccines that is perfectly normal and expected. Olga, let me turn it back to you.
Thank you so much. And I'm going to be honest, I was concerned about feeling ill after a booster shot, but after hearing from Del Rio and Dr. Scott and Dr. Zinner, I'm going to get mine tomorrow, and that's a promise. So we have a couple of great questions about home testing. Viewers want to know how important it is for these home tests, and will it become easier and less expensive in the future? Dr. Zinner?
Earlier, I asked Dr. Jha for his perspective, keeping in mind that none of the results that are done with home testing are reported to public health facilities, which means we won't know in a public health way what the effect is and whether or not patients are sick or not sick. Here's what he had to say.
I'm a big fan of these home tests. I think, if you wake up one morning, you have a fever, cough, instead of going out to work or to school, wouldn't it be great if you just get a home test? If you're positive, you're going to want to be more careful. You want to isolate. It does raise exactly the issue you raised, Mike, which is that how will we know and how will we be able to track? My hope is, and what I tell people is, if you're positive, you should probably go ahead and get a PCR test, kind of one of those other tests. You talk to your doctor and get that test. That will both confirm and also help us track. But we'll miss some of those, and it's not great, but I'd rather miss some of those cases in terms of our tracking than to have infected people walking around and spreading it.
Tina, we talked earlier about the issues of just vaccinations in the underserved community and in some of the communities of color. What about home testing in that same community? Do we have a problem with access there, and do we have a problem with issues there?
Yes, we 100% have an issue with access, and fast, frequent testing is really critical, especially in communities of color. And many of the residents who live in these communities are at increased risk of exposure, living in cramped housing conditions, and working in frontline industry jobs. And so, for me, I think that we really do need to focus on those communities to provide more affordable testing, if not providing it completely free. And it's something that the government really should fund, with these communities that are being disproportionately affected by this virus, and also providing it to providers like myself who work in these communities.
Carlos, I wonder on your thoughts too. I mean, you work in Grady Hospital, a hospital we know is also serving the underserved community.
Again, I agree with what Tina has said. I think this test needs to be available. I think it's outrageous that we pay the price we pay for this test. I mean, yesterday I went to buy, two of these packages to test people I knew, and I paid $50, which is for most people would be impossible to pay. This test, as I said, in Germany, available for $1 a shot. In the UK, you get them for free. I really don't understand why our government has been incapable of making them available so people can get them, because the reality is if we can test people and people can test themselves at home, as Ashish said, makes such a big difference. If I'm symptomatic today, and I think I may have a nasal congestion and I want to be sure I don't have COVID, I can test myself and be done. But we have not done that in our country, and that has been a major failure from the beginning and continues to be a failure today.
Thank you. Olga?
Thank you, Dr. Zinner. A couple more questions I'd like to get to. One from our viewer, Linda. She asked if the vaccine can prevent long COVID. There's the question right there. So if we can take that one for Linda. Dr. Zinner?
Well, actually, I'm going to ask both panelists. First, let me start with Tina. Your thoughts on that?
So yes, we are seeing some data to show that that the vaccines can actually reduce the symptoms of long COVID. And I think a lot of parents think that long COVID is only an issue for adults. And I'm actually seeing quite a few kids who have had COVID infection that are presenting with long COVID symptoms. And I think unfortunately we're probably going to see a lot more of that. So I think there is definitely a benefit to getting vaccinated.
Carlos, your thoughts?
I think, Michael, it's pretty clear that this is important. First of all, if you get a vaccine, you don't get infected, you prevent long COVID. But the other thing is that people who have COVID, if they get vaccinated after having COVID, you're less likely to develop long COVID. It's a very good study now out from the UK, from London, showing very clearly that people who have had COVID and were vaccinated are less likely to have long COVID. And that's one of the reasons I tell people who had COVID get vaccinated. It's not just saying, oh, I got natural immunity, I don't need to worry about it. Vaccinating yourself can actually prevent you from getting long COVID.
Olga, back to you.
All right, Dr. Zinner, I have a question here that just came in regarding natural immunity versus vaccine immunity. Great question. Does a prior COVID infection protect you better than the actual vaccine? I get this one a lot, Dr. Zinner.
And I'm going to ask both our panelists about this one. This has been a very important discussion, not only in the health community, but unfortunately it's made it into the political world. And so let me ask both of you, and let me start with Dr. Del Rio. Carlos, your thoughts on that?
Well, I'll start by saying that, yes, after you had COVID, you certainly develop immunity. There's no doubt about that. And again, I don't like to call it natural immunity because the immunity you get after vaccines is also natural. I like to call it infection-related immunity versus vaccine-related immunity. Infection-related immunity is actually pretty good. The problem is very variable. If you're a male, if you're older, if you had severe disease, you're more likely to have significant immunity. But frequently women, young people, people who had mild disease may not develop immunity. So just because you had COVID doesn't mean you are immune. The second thing we learned is that natural immunity wanes over time a lot faster than vaccine-induced immunity. But the third thing that we learn, and to me is the most important thing, is that people that have, infection immunity, if they get vaccinated, they actually have the best immunity ever. Shane Crotty, who's an immunologist at Scripps, called this hybrid immunity. And people with hybrid immunity have actually the best protection ever, even over very good against Omicron. So I tell people who had COVID, get vaccinated. In Europe, if you had COVID and you take one dose of vaccine, you're considered fully immunized. I tell people at least get a dose of vaccine. If you get two, you're even better. But there's no risk of taking the vaccine. And to me, hybrid immunity is the way to go. You had COVID before, get vaccinated, get hybrid immunity, you'll have the best immunity ever.
Tina, thoughts?
I actually have nothing to add and agree 100% with everything that was said.
Thank you.
All righty. We have another question from Lydia. She wants to know if the COVID vaccine is temporary. Dr. Zinner?
Dr. Del Rio, your thoughts on that?
Well, we just don't know, right? Because this is an evolving epidemic and things are changing. So is it helpful today? Yes. Will it be evolving? Absolutely. Is it temporary? We don't know. We're learning about the vaccines as we go along. I mean, one of the things that is most difficult for people to understand is we don't have all the information. We're making the science as we go. And that is very disconcerting. People get very anxious because we don't know. It's really hard to predict the future. And most of us we would like certainty in our lives. And the lack of certainty, I think, is what creates a lot of anxiety in people. So the reality today is that a lot of times the answer needs to be, the honest answer is we don't know. But let's look at what we know today. And based on the evidence we know today, get vaccinated. Will that vaccine last in 6 months or a year? I don't know. Will you need another booster then? You may. But the reality is, get vaccinated today so you don't get infected, so you don't die, so you can be here in a year from now, and then we'll have that discussion.
Dr. Del Rio, that's a great way. And the analogy is often we're flying an airplane while we're still making the airplane. And who knows? I hope the science evolves. It will evolve. But let me turn it back to Olga.
All right, a couple questions here, Dr. Zinner, both same theme, if you will. How about the new medications? Do they work? Another viewer asking somewhat of the same thing. How about the vaccines they're trying to develop against Omicron? Are they better than medications, or should we turn to medications? Your thoughts?
So, Tina, I'm going to ask you this question. I'm going to put in my own bias a little bit. I'm not sure we can medicate our way out of this pandemic. Hopefully we can vaccinate our way out of this pandemic. But I would be interested in your thoughts on where we go with the current medications and Omicron.
Yeah, we definitely cannot medicate our way out of this pandemic, although the vaccines will be a key component to ending this, but it's not the only solution. And as I stated before, it has to be a comprehensive solution, which includes not only the vaccines, therapeutics, all of the mitigation strategies that we've been using, the masking, which helps to reduce transmission significantly. And prevention is key when it comes to this virus. I've had so many people who have decided not to get vaccinated and tell me that they're waiting for the COVID pill. And I tell them that, waiting to get infected and then take a pill is a risk in and of itself, because there's no guarantee that if you get infected, what the severity of your illness will be before you even have access to this medication. And, and I also think that we're at a point in this pandemic where the choice is not really whether you should get vaccinated or not, but rather, getting vaccinated or getting the virus. That's where we are right now. And which one do you trust more? The well-researched vaccine based in science, or this virus that just came onto our radar less than 2 years ago, and that we're still learning more about. We know a lot more than we did a year and a half ago, but there's still so much more that we don't know. And there is a randomness and an unpredictability with this virus where, we really need to be 10 steps ahead at all times and be proactive instead of reactive. And the vaccines are a key component, to us getting ahead of this virus.
Thank you. Tina, back to you.
Thank you, Dr. Zinner. We have time for one more question. So many viewers are asking this over and over again, and it's the question on everybody's mind, Dr. Zinner. When will this pandemic come to an end?
And I want to hear from everyone on the panel, but I also had the opportunity to talk to Dr. Jha and Dr. Mestre earlier. Dr. Jha.
The vaccines are very safe and very effective in terms of preventing, number one, infection, and number two, any serious complications from infection. So what we want to do is to try to get out of what we call a pandemic and make this more an endemic.
The big picture things I'll say is every pandemic comes to an end. This pandemic is going to come to an end. I think it's going to come to an end sooner rather than later.
Well, I think we're going to hear final thoughts from everyone, Dr. Zinner. So let's bring in first Dr. Del Rio. Dr. Del Rio, final thoughts. We've got about 2 minutes left in the show. It's been so valuable. Your thoughts on just this end?
Well, I want to be optimistic. I agree. This pandemic is going to end, and it's going to end when we want it to end. The faster we get people vaccinated, not only in our country, but globally, the more we can stop transmission, the sooner we can end this pandemic. So if we want to end this pandemic, get vaccinated, and more importantly, also get our government to support vaccination globally. Because if we can get the globe vaccinated, if we can stop transmission, we can end this pandemic. This should be a wish that we all have. We should come together. This is not a Republican issue, a Democratic issue. This is a human issue. And if we all come together, we can end this pandemic.
Tina, we only have about 10 seconds. So can your final thoughts?
Okay, as stated before, all pandemics eventually end, but I think we have to decide as a society how we want that ending to look. And we've already had a tremendous loss of life, and we're beginning to see the long-term effects of this virus on those who have survived. So I think that we need to remain full of hope and not despair. And the vaccines are a key component to getting us back to some type of normal.
So let me end by saying it's been a horrible 2 years. There's a lot that's happened. There's a lot that's not happened. And hopefully that what's not happened, like cancer care and routine care, can be accelerated. We're living through the end of this, or toward the end of what we hope to be the end of this, and we look forward to what's going to be a positive result as we go into the next year. Olga?
Thank you, Dr. Zinner. Thank you so much. We appreciate your time. Be safe. Enjoy the holidays. We'll see you next time. I'm Olga Villaverde. You take care.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund. Living Minute, a look at the latest in medical innovations changing our lives. Students are going back to school, and that's got many parents, teachers, and school administrators concerned as cases of the highly contagious COVID-19 Delta variant continue to rise. Many are now advocating for a nationwide COVID-19 testing program in schools, taking advantage of the $10 billion in funding made available by the Biden administration. One such program, Ready, Check, Go, was recently launched by Thermo Fisher Scientific. It maps out a streamlined protocol for students K through 12 to swab and submit samples for testing each day. Experts say testing in schools is a critical step to monitor and control the pandemic. For more on the program, visit livingminute.tv and click on the thermofisher.com/ReadyCheckGo banner.